expected of them. It's another fine afternoon. Thank you so much for joining us. Welcome to Your Viewpoint. This program is designed to encourage moral values and, of course, provide possible solutions to societal issues. I am Rotimi. Akintunde. Today, we're talking about malaria. Despite the fact that malaria is a preventable and treatable disease, it has continued to have a devastating impact on the health and livelihood of Nigerians and even at the world at large. Today, we're looking at measures we need to take as a people to see how to prevent consistently malaria and see what to do, how to handle it properly when it happens. I have in the studio this afternoon, I have the acting medical director, Besthope Hospital. That's Dr. Amos Akojima, Dr. Amos Alex Akojima Graham. Thank you so much for joining us.
Good afternoon.
All right, very quickly, we'll go straight to the discussion for today. We're looking at malaria, and this is something very common. This is something a lot of people talk about day in, day out. In fact, people talk about the causes of malaria, and of course, there are so many misconceptions about what malaria is all about. Of course, the popular knowledge about malaria is that it is caused by a female mosquito called Anopheles. But as a doctor, how would you describe malaria to us?
Thank you very much. Malaria is a protozoa disease that is caused by Plasmodium species, transmitted by infective female Anopheles mosquito.
Okay.
There are 4 species of this Plasmodium parasites. We have the Plasmodium falciparum, that is the most widely distributed of the species, especially in the African continent.
Okay.
We have the Plasmodium ovale, Plasmodium vivax, and Plasmodium nulci. Plasmodium falciparum is ascribed as the most devastating of all of the Plasmodium species when it comes to malaria infestation, as it is associated most of the times with severe malaria, right? Recently, as found out in countries like Singapore, Thailand, Malaysia, Plasmodium nulci is found to have similar clinical presentation to Plasmodium falciparum. So as a matter of fact, the management of malaria from Plasmodium falciparum is similar to Plasmodium nulci malaria.
All right, let's quickly look at it from a simple perspective, so to speak. Now, people talk about, you have also talked about the female mosquito, the Anopheles. Now, is there a need for people to even determine which one is causing malaria? Is there a need for that?
There's really no need for that, because as a matter of fact,
yes,
looking at the mosquitoes around us, there is no way you will know which is which. As a matter of fact, it's only zoologists who will have this understanding.
Okay.
As a matter of fact, looking at them, except they are subjected to laboratory.
Fantastic. So in that regard, it is not. There's no point for the layman to be concerned about whether it is Anopheles or not. So in that regard, how do we now put it to people if we have female mosquitoes causing malaria? Does it mean the male mosquitoes don't cause malaria?
Okay.
What happens?
The male mosquitoes do not cause malaria.
Okay.
As a matter of fact, the mosquitoes are not the causative agents.
Okay.
They are just vectors. Vectors are like vehicles that convey disease-causing microorganisms.
Okay.
They remain uninfected.
Okay.
All right. So in malaria infestation, the female Anopheles mosquito is the vehicle of the transmission of the parasite.
Okay.
Okay. So as a layman, you don't, even as a medical doctor, you don't even need to stress yourself trying to decipher which is which when it comes to distinguishing male from female Anopheles mosquito.
Okay.
If I see a mosquito today,
Okay.
I wouldn't know if it's a male or a female because I'm not a zoologist.
Okay.
All right. So it is left to the zoologist to, you know, for scientific purposes, research purposes, they do that.
Okay.
But we are into prevention and management. We're just concerned about when you come, if there will be need, because we're actually at the we are actually advocating preventative means of managing any medical condition, because most medical conditions are actually preventable, right? So we are concerned about the preventative measures, all right? And if prevention fails, you know, we now talk about treatment.
Now, let's quickly look at the plasmodiums, which you have talked about. Now, you mentioned that these mosquitoes are carriers, so to speak. Where do they get those things? They transmit into people's body, which we call malaria, so to speak, or which is the reason for malaria.
The truth of the matter is the plasmodium is inside of those who have the parasite in them.
Okay.
Right?
Okay.
They don't pick it from the ground or from the air or from the water. All right? They pick it from human beings like you and I.
Okay.
All right? But there are situations where the environment becomes conducive for them to carry out that act of or activity of getting the parasite from man. Right? That's where the import of the understanding of the life cycle of the parasite comes in.
Okay.
Now, I will just briefly, if it's possible, let me briefly discuss the life cycle of the parasite, because it is very key to understanding the transmission of the germ that is responsible for this infection. Now, when mosquito, I'm using the word mosquito now to, you know, imply the female Anopheles mosquito, because that's what we're concerned about now, all right? When mosquito latches on the skin, it uses its mouth to pierce the skin and suck blood, all right? So when it sucks blood, somebody who has the parasite in him, the blood gets through the point where the mosquito bites and gets, you know, into the saliva. So that's from the saliva, the parasite moves down the intestine of mosquito. All right. At that stage, you know, reproduction takes place. Usually it is the sexual form of reproduction that takes place within the mosquito. All right. The male and the female parasite, technically we call them gametocytes. Male and female gametocytes will fuse to form what we call zygote. The zygote in this term is, there's a technical term for that we call ookinete. All right, it is what now metamorphoses to oocyst. The oocyst will now again metamorphose to sporozoids. It is the sporozoid that will now move from the intestine to get stored in the saliva of the mosquito. So that is how it gets it from somebody who has the parasite. Now it comes, it bites you. You do not have the parasite, ab initio, all right? So it bites you, it sucks blood, and then transmits the parasite already in the saliva into you. So the parasite, the sporozoids now move from your blood to the liver. When it gets to the liver, it keeps replicating itself. It keeps producing more of itself. As it produces, it now gets to a point where it matures that we call merozoites. So it is now the merozoites that will be released into the bloodstream. From the bloodstream, it finds its way into, they have predilection to red blood cells.
Okay.
So from the peripheral blood, they now enter the red blood cells, and then continue the development again to what we call trophozoites. And then the end point of it all is the schizont.
All right.
So,
okay, let's. You've been able to say a lot about the development. Now, let's talk about the environment where mosquitoes grow.
yes.
Now, when you talked about the life cycle of mosquitoes the other time,
Yes.
I was thinking you were going to talk about the what we were taught in school back then. Eggs grow into lava grows into pupa grows into adults.
Oh yes, so yes, it's you know, we have different life cycles.
Okay,
you know.
fantastic. So let's look at how our environment, because I know we cannot leave out environment when it comes to environmental factors, when it comes to development of mosquitoes and all of that. So to what extent would you say our environment has something to do or has a lot to contribute to development of mosquitoes? Yes, the growth of mosquitoes. And how do we work on that as a people?
Yes, the environment plays a very tremendous role in the life cycle of mosquito and ultimately in malaria burden. Mosquitoes thrive in an unhygienic, dirty environment. So where you find stagnant water, you will find mosquitoes there, because that is the favorable environment they need to reproduce. All right. So environment plays a very crucial role, because first of all, it is the ingredient that is required for the proliferation of mosquitoes, and that will ultimately result in increments in the malaria burden we have in our society.
Okay, but then you talked about stagnant water.
Yes.
But don't forget that when there are situations whereby we have this dry season, so to speak, and you still find mosquitoes. In fact, very wicked mosquitoes, in quotes.
Yes.
What happens at that point?
You know, all organisms have seasonal distribution. Right? Usually, in the rainy season, we have a lot of mosquitoes. Because of the fact that there are ports where we have stagnant water for them to produce more of themselves. But when dry season comes, we really don't have more of them. But that does not mean that mosquitoes have either gone hibernating or they've gone on exile. Not at all. It's just that the burden, the propensity for them to produce more of themselves reduces naturally. But in the practical sense of it, it is not what obtains. Because if your environment is tidy, Mr. B's environment may be unhygienic. So there are mosquitoes that are there producing more of themselves. All right? And they fly in the air. So if you are able to protect yourself by having a very clean environment, it does not protect you from coming down with malaria, because Mr. B, who lives, in a very dirty environment, breeds mosquito. All right, and they will find your ways to where you stay and place with you.
So in that regard, what are you supposed to do? You have neighbors that are dirty, or you live in a neighborhood that is quite dirty.
Yes.
What responsibility do you have to protect yourself?
That is why the role of education comes in. Right? Really, we have a lot of people who are ignorant of the fact that stagnant water plays a very crucial role in the procreation of malaria. They should be educated. We should let them know that this dirty environment, presence of stagnant water, are factors that allow the growth and reproduction of mosquito. But the truth of the matter is this: Even the farmer we have out there knows that malaria reproduces. I'm sorry, it knows that mosquito reproduces itself in stagnant water. They will see and pass by. Tomorrow they will come and dump refuse in that same stagnant water, and more of the more mosquitoes will produce themselves.
Okay.
All right. So what are the measures to prevent stagnancy or accumulation of stagnant water in our environment today? Environmental sanitation is very vital. All right. We should understand that the government cannot do everything for us. We have a very important role to play in ensuring the safety and conduciveness of our environment. Walking on the street today, you see people dump refuse indiscriminately. That is absurd. All right. Having a clean environment, cleanliness, they say, is next to godliness. All right.
That's right.
Having a clean environment will reduce tremendously medical hospitalization for malaria, because if the environment is clean, there is no way mosquito parasite will breed, and if they do not breed, there is no way there will be transmission of malaria parasite.
All right, let's look at misconceptions about the causes of malaria.
Okay.
We've talked about mosquitoes being the cause of malaria. Now, is mosquitoes the only cause of malaria?
Okay. Truth of the matter is there are misconceptions. People will come to tell you that whenever they are stressed, they will come down with malaria.
Okay.
Or when they drink dirty water, they come down with malaria. That is spurious. There will never be malaria without mosquito. And the only way you have this malaria is when an infective female Anopheles mosquito transmits the parasite into your bloodstream.
So you're saying there's no malaria without mosquito?
Yes.
Wow. That's interesting, because we've also seen people talk about the fact that, the sun, when you stay under the sun for too long, in fact, you see parents, get out of the sun, that could bring about malaria. How true is that?
The truth of the matter is you cannot underestimate the role of ignorance in the development of diseases. The truth of the matter is this: when one has malaria, there are times when I discussed the life cycle, I got to a point where I said some of the in the stages of the development, yes, some of the parasites, okay, that we call merozoites will rupture, will enter the bloodstream. From there, they enter the red blood cells. Each time the red blood cell bursts, there is a spike in fever. There's a spike in temperature. All right. So when there is rise in temperature, it lasts for some minutes, and then the person will not be shivering and has cold. All right. The cold that the person has is called chills. That chills makes them. They get relief by staying in a sunny environment. All right.
Okay.
Or to be honest with you, when you have the chills, from malaria, you stay under the sun. You enjoy it.
You feel better. You feel better.
So that's what That's what underlies the misconception.
People have bring about malaria.
That sun brings about malaria.
Okay, fantastic.
Yes.
We will get to talk about the symptoms, the signs we'll see when somebody has malaria.
Okay.
We will go on this break, and when we're back, we'll talk more. I've been speaking with Dr. Amos Alex, Akojima Graham, and we'll be back. Please go nowhere.
Did you know if you fail to plan, you are only planning to fail? Just as starting a business requires a business plan, so also does investing requires a plan. You can discuss with your financial advisor on the best possible plan for you. Now, before you rush into investing your money in any business opportunity, I think it's worthwhile. You should do a thorough research on the businesses you can venture into while keeping the following in mind. Invest in something you understand. There's a strong interrelationship between business and investing. Just as it is advisable you start a business with a thorough understanding of the industry you are going into, the same is applicable to investing. Sometimes people start a business or buy an investment based on the recommendation of a friend or their financial advisor. Others invest in an investment product just because someone succeeded with that same product. This approach is wrong. With the understanding of the business or investment, you will be able to maximize your profit, manage risk, and minimize your loss in any investment. Invest in something you are passionate about. You have to be passionate about investing to get the best out of it. You must love the game regardless of whether you win or lose. Never invest in something you are not passionate about. You will only end up with a heartache. Invest in something you are willing to learn through. Life is a teacher. The more we live, the more we learn. The only thing constant in life is change, and in the world of investing, such change occurs very rapidly. Investing is like a rapidly flowing river, and to stay on course, you have to be on the edge, ever ready to learn. Invest in something you're willing to stick with. For everything, there is a season. Business and investing has its good time and bad time, highs and lows. If you are not persistent enough, you will give up. So before you commit your money to any business idea or investment, be sure you are prepared to follow it through to the end, which might lead you to either losing your money or making some profit. Never invest in something you are not willing to stick your neck with. Invest in something you have control over. Control is one of the most important criteria every successful investor looks out for in an investment. Never lose control of your investment because control is essential to risk management.
All right, thank you so much for staying there. You're still watching Your Viewpoint, and we're still talking about malaria prevention and treatment. I've been speaking with Dr. Amos, and we have been talking about the reasons for malaria, how mosquitoes develop and all of that, the misconceptions, and all of those things you need to know about what malaria is exactly. But this time around, let's really talk about the symptoms. Before we went to that break, we talked about the symptoms, just one or two, regarding how you stay under the sun and you feel better.
Yes.
And when it's evening, then you feel cold. That is quite common.
Yes.
A lot of times. So let's quickly look at the symptoms you tend to get when you are having malaria.
Okay. Now, I'd like to let us know that there are no hard and fast rule when it comes to the signs and symptoms of malaria. Meaning, there are no signs or symptoms that are specific for malaria because most of the clinical features a patient that has malaria presents with can be found in other ailments, such as bacteria and other parasitic infections. But in a nutshell, there are salient features that must be present that you see most of the times in patients that have malaria. First, you have headache. They will tell you they have this dull, aching headache that does not abate after using painkillers. Right? They will have fever, and this fever has is a unique feature in that when the fever is simply elevation of body temperature. All right. So most of the times in patients that have malaria, there are times the temperature will be high. When it goes high, they will be hot. And most of the time when you check with thermometer, you discover that it is high. At least you see I think something above 37.5 degrees Celsius. Right? You could see as high as 39, even as high as 40 degrees Celsius.
But on a normal day, it should be at what level?
On a normal ground for adults, their body temperature should be between 36.5 to 37.5 degrees Celsius. For children, their normal body temperature should be between 36.5 and 37.2 degrees Celsius. So any elevation above the upper limit we call fever, meaning you have in adults, for instance, you have temperature that is reading. You have thermometer that is reading temperature of 37.6 degrees Celsius and above. We say the person is feverish. For children, when you have thermometer reading temperature of 37.3 and above, you say the patient is feverish. So they have fever, the temperature will be elevated, and after some time, they will feel chills, they will be shaking. We call it rigors. Or at that moment, they tend to like to stay under hot environment, like staying under the sun.
And that's why some people tend to use cover clothes.
Yes, and they will sweat very well.
They sweat,
right?
Yes.
So our forefathers will say, oh, when you sweat, the parasite is dying. It's part of the misconception. Okay. So you have fever, you have headache. Sometimes they present with cough. All right. They present with weakness. They will tell you they are very weak. All right, but in some occasions you see that they will tell you they are vomiting, they are nauseous. That is, they have the propensity to vomit. They have the urge to vomit. They could have cough. They could have loss of appetite that we call anorexia. All right, like I said initially, these symptoms are found in other ailments. Okay. It is the clinician that will be able to tell which is which. It is the clinician who would say, oh, this is likely malaria. And of course, as a clinician, there are other, questions we ask, to unearth the presence or to rule out malaria in patients that present to you at your facility. Now, those are some of the symptoms. In some situations, in severe cases, you could see a patient that has malaria presenting with convulsion, with coma, with difficulty in breathing.
Is that peculiar to children?
It is not peculiar to children.
Okay.
You find that both in children and in adults. All right, but it is commoner among children. Okay. All right, it is, like I said, it is found both in adults and children. But it is commoner in children. All right, so those are some of the symptoms. And I'm sorry to say, what you may not even understand what we call symptoms. Symptoms are subjective features of a disease. We call it subjective because it is what you tell the clinician. The clinician was not there when you were experiencing them. So you may not be telling the physician the truth. So that is why we call them subjective clinical features of diseases. All right. Now we have signs. Signs are objective clinical features of diseases. This is what the clinician sees and documents that this is what the patient presents with. This is what I find on examining this patient. So they are objective. They are objective because as clinicians we are trained to see those signs. We are trained to know what is happening in your system. We are trained to be able to establish a disease or any infection or any ailment by analyzing the results, the findings in examination. All right, and what we find in examination are called the signs. So in malaria, for instance, one of the important signs we'll see is fever. All right. So you come to the hospital. The nurses will take your vital signs. Vital signs are very important. They are very important signs that enable the clinician to have an idea, an idea of what you are likely presenting with when your case notes or your folder gets to a stable.
All right.
So we see fever, right? The physician may see that you are not able to move your body. That is an important sign. We call it prostration because, like I said initially, patients will come to tell you, oh, they are very weak. They've lost appetite. It is because of malaria. So what the clinician sees is not weakness. The sign it sees is prostration. All right. So you can see how we relate symptoms and signs, symptoms on the view of the patient and signs on the view of the clinician.
All right, that's a great one. You've been able to differentiate between signs and symptoms. I want to believe some medical students will be learning that, who would understand that better. All right, let's quickly look at people who do not have quick access to the hospital or to clinics, so to speak. What should be done when malaria comes up? When you think or you have that observation that, oh, this might possibly be malaria. Take, for instance, for children that are under 5. When we talk about vaccines and all of that, they are reported that sometimes vaccines don't get to children that are under 5 years of age. And as a result of that, most of them are vulnerable to malaria. So in that regard, what can be done? Okay, as a parent, you realize that, okay, your child is feeling feverish or there's convulsion or whatever it is. What should be done? What should serve as some kind of first aid for that kind of situation?
Okay.
If it is malaria.
Okay. Thank you very much for that. Yes, in all ailments, first aids are available, especially in resource-poor settings where you do not have ready access to health facility. Now, for malaria, we do not encourage abuse of anti-malarials, right? When you have a child that runs temperature, that is feverish, the first aid you will give is to give acetaminophen, paracetamol, all right, to bring down the temperature. And once you give, immediately present at any health facility around you. We have health facilities everywhere. The government has done tremendously well financing and supporting primary health care, primary health centers,
That's right.
in most of the remotest villages in the country. So you take your child there, they would know what to do for the child. But the problem we have in this part of the world is we abuse medications, all right? And I know we'll still get there very soon, but I just want to quickly, give this, we abuse medications. When you give paracetamol, for instance, to bring down the temperature, it is just enough. That does, if even the temperature comes down, of course it's going to come down because it is an antipyretic. The role it plays is to bring down temperature. So once you give, immediately present at the facility. So what happens in most villages and even in most urban centers today is when they give the acetaminophen and the temperature crashes, they don't come to the hospital again. They feel the baby is okay.
They don't want to spend much money. Some people will say, oh, okay, they don't have to spend money on that anymore.
Is a possibility anyway. The things like that, like life is hard everywhere, is a possibility. But the truth of the matter is that is not the major reason, right? The fact that they don't want to go spend in the hospital is really, most of the time, is not the major reason. It is just ignorance. Okay, and the truth is, paracetamol and other antipyretics mask fever, mask the clinical improvement.
When you say mask, it hides.
It hides. Yes, it hides the clinical improvement of any patient. When it comes to managing any ailment, all right. So when you should not give it more than once. Once you give, immediately take this baby to the health center. The baby will be examined. Baby will be tested. We encourage testing before treatment.
Let's talk about self-medication, which you were going to talk about the other time, and that brings us to a lot of drugs out there, a lot of substance people buy at the pharmacies and all of that.
And even online.
Yes, a lot of it. To what extent would you advise that those things should be encouraged? Because sometimes people just say, okay, they feel okay, once this thing, they mention some substances, so to speak, as part of what is used to make that drug. And they feel, okay, once they have that, the malaria will go and they start taking it just like a doctor has prescribed. what is your advice? And don't forget the fact that we have pharmacists
Yes.
in some places.
Yes.
So with the presence of a pharmacist, prescribing all of these drugs, do you think it's still safe? Do you think it will still mask the malaria, so to speak?
The truth is this. We have pharmacists everywhere. We have chemist shops everywhere. They are not trained to diagnose diseases. It is the onus of medical practitioners to diagnose diseases. That's what we spent over 6 years studying in the university. All right? So long as you have changes, abnormal changes in your system, know that there is a problem. So it is telling you, those changes are telling you that it is time you went to see a doctor. All right? I can never subscribe to self-medication, because now in the past, medications were on ground to treat malaria, and other ailments. We are in a very dangerous era now, era of resistance of germs to medications. It is because of the negative role self-medication has played in our system, right? When you suspect you have malaria, do not use anti-malaria. Do not self-medicate. Go to any health center where appropriate diagnosis can be made and you are treated. Now, the negative consequence associated with self-medication in relation to malaria management is resistance of the parasite to treatment. We have treatment failures. All right. When you think you have malaria, it may not be malaria. It could be any other disease. It could be any other infection. All right. When you think you have malaria and you just go to a nearby pharmacy
and tell them you have malaria,
and most of them they will tell you they have malaria. You will be surprised they will come to tell you they have malaria. No. You are not the doctor. It is the doctor who makes that diagnosis. So they will tell you they have malaria. They will tell you the drug they even want to buy. All right. They will tell you, I need this drug. Get me this drug. They will use it. They don't feel better. All right. Why? It may not be malaria. You have introduced a chemical to your system that your system does not need at that point in time. And there is no medication without its side effect. So when you take that medication that your body does not need at that point in time, when you now need it, when the system now needs it, you use the medication, it will not work for you.
Okay.
So that is the genesis of resistance.
All right, that's quite interesting.
To medications.
I must say
those germs.
All right, let's look at. We're going to go on this break, but before then, very quickly, in just a few seconds, what is your take about who is susceptible, who is vulnerable to malaria? Some people, they tell you, oh, I've been living in this environment for long. I don't have malaria. Mosquito cannot bite me. Even if mosquitoes bite me, I can do something about it, And that takes us to the use of herbal mixtures.
Yes.
All right? Which, in Yoruba, some people call it Ogweba. Okay? Iba is what we call, for the benefit of those who, it's still what we call malaria. So they use a lot of concussions, so to speak. Yes. What is your take about that in few seconds?
Okay, now you have asked two major questions to be attended to in few seconds. First of all, I can remember clearly you talk about my view on,
about who is vulnerable.
Who is vulnerable.
Who is vulnerable?
That's
do we have people who are not vulnerable, who are not susceptible to malaria? Is there anybody that malaria cannot affect, so to speak?
Yes.
Really?
Yes. Okay. But that is a very broad topic. All right. That the few seconds will not be able to analyze. I want to ask if it is possible for us to discuss that after the break.
Okay.
But I'll just quickly say something about the role of herbal concoctions in the management of malaria.
Yes.
The truth of the matter is this: herbs are very efficacious in the management of any ailment. All right. But they cannot, they are not dosed. All right. The herbalist does not know how to dose those drugs.
Okay.
All right. Now, most of the medications we have, like for instance, most of the anti-malarials are synthesized from herbs. They are subjected to critical purification processes to isolate what we call the active ingredients, which are required to kill or to eradicate the malaria parasite already in your bloodstream. So the herbal concoction contains both the active ingredient and the impurities. All right. What segregation does, what a purification process does, is to separate the impurities from the active ingredients so that your system just absorbs the active ingredients and then it does its work. All right. So when you take herbal concoction, yes, some of the active ingredients that are there will take care of the parasite, but the impurities will go play with your kidney and your liver. And in the end, you may come down with kidney or liver problem.
All right, thank you so much. We will go on this break, this sport break, and when we're back, we will talk more on all of these things we've been talking about. We've been talking about malaria prevention and treatment. After the sport break, we'll get to see what people have to say. People on the streets who were on the street to interview them, and they had one or two things to say about malaria. Right. We will be back. Please go nowhere.
The first official World Cup was played in August 1930, and since then the tournament has been held every fourth year, with exceptions for interruption due to the Second World War. There were, however, unofficial pre-FIFA World Cups already in the late 1800s, in a time when only few national teams existed. Another unofficial World Cup arranged before 1930 was Sir Thomas Lipton Trophy held in 1909 and 1911. Besides that, the Summer Olympic football competitions will be a mark of which the best national teams were before 1930. The Olympic tournaments consisted, however, only of amateur teams. The World Cup became the real deal. The FIFA World Cup is a tournament of men's national teams that determines the sports world champion. It is likely the most popular sporting event in the world, drawing billions of television viewers every tournament. The equivalent event for women's national football teams is the Women's World Cup. The cup awarded from 1930 to 1970 was the Jules Rimet Trophy, named for the Frenchman who proposed the tournament. This cup was permanently awarded in 1970 to the then three-time winner Brazil, 1958, 1962 and 1970, and a new trophy called the FIFA World Cup was put up for competition. Many other sports have organized World Cup competition. The 2022 FIFA World Cup is an international association football tournament contested by the men's national teams of FIFA member associations. It is the 22nd FIFA World Cup, a worldwide football tournament held once every 4 years. It is taking place in Qatar from 20th November to 18 December 2022. This is the first World Cup to be held in the Arab world and the second World Cup held entirely in Asia after the 2002 tournament in South Korea and Japan. At an estimated cost of over $220 billion, it is currently the most expensive World Cup ever held. France are the defending champion, having defeated Croatia 4-2 in the 2018 FIFA World Cup final. This tournament is scheduled to be the last with 32 participating teams, as the field will increase to 48 teams for the 2026 edition. Because of Qatar's intense summer heat, this World Cup is held during November and December. It is being played in a reduced time frame of 29 days. 64 matches are being played in 8 venues across 5 cities. The opening match was between Qatar and Ecuador at Al Bayt Stadium, Alco. In their first ever World Cup appearance, Qatar lost 2-0, becoming the first host nation to lose their opening game. The final will be held on 18 December 2022 at Lusail Stadium, coinciding with Qatar's National Day.
My name is Virginia. Every summer.
1.
Sensitization one. Number two, enforcement. You know, Nigeria, we create laws, we don't enforce. If you say don't throw something on the gutter, in the presence of a local government task force, someone will pour something in the gutter. When you speak the person's language, I 1 year, you are gone. You are free. So, number one, sensitization. Number two, enforcement. No matter whose fault is God's, enforcement. If they catch you, you pay. So someone else that's watching you will learn.
Well, environment is a factor which everyone needs to take care of your environment. Like we normally say, cleanliness is next to godliness. So my advice for everyone, like the nature of my job is environmental, we all need to keep our environment clean in order to avoid all these malaria, parasites and all these things.
Well, malaria is like normal thing in Africa now. If you like eat healthy, man, malaria will still come at you. It's just normal. It's one of our things. Yeah, true. There are places that you will get more of the mosquitoes than some other places. That's true. But I ask you, malaria is like it's a Nigerian thing. It's a Nigerian thing. Yes, there should be. If not for malaria, just for you to live healthy, your environment should be clean. Just for you to live healthy, I know your environment should be clean.
My name is Engineer every summer.
About malaria prevention and the treatment. On your viewpoint, I still have Dr. Amos in the studio, and the other time we were talking about whom malaria can affect. Some people will tell you they've been living in a particular environment for years and they don't think mosquitoes can have effect on them, so to speak. So is it possible to have people whom malaria cannot bring down, so to speak?
Yes, I will say a yes to that, because there are people who over time have developed immunity to malaria. The reason is not far-fetched. Most of the times, those set of individuals, when they were growing up, were candidates for malaria parasite, meaning they usually come down with malaria most of the times twice a month, 3 times in 6 months, like it was frequent in them. All right, so what it does to them then is it was building their immunity. All right, so long as they remain in high malaria burden environment, with time the immunity will be built up. All right, it will get to a time in their later life that even if they are exposed to, they live in a house that is filled with mosquito and they are bitten, several parasites were infused in them. Most of the times the parasites will die natural death in them.
Wow.
They will not present with any symptom because of the immunity they have built over time. But that immunity only remains, they only enjoy that immunity so long as they remain in malaria, in malaria endemic area. Okay. Endemic means is high burden. Okay. Right? A zone, an area where the burden of malaria is very high. Okay, so long as they remain there, they enjoy that immunity. But when they leave malaria endemic area for another area, for instance a low endemic area, let's say they go to the USA or they go to the UK, they stay there for some years, that immunity is lost. And when they come back to Nigeria, the propensity that they will have malaria, and sometimes in a very severe degree, is very high because the immunity is already lost. Wow. So it is not a lifelong immunity per se, all right? But there are people who have who have some levels of immunity, to malaria parasites.
Wow, that's interesting.
And
and in that regard, okay, you want to add something?
Yes, that is how that's on the one side. Okay. Then there are some people, by virtue of their genotypic configuration. Okay. All right.
You're talking about genotype now.
Yes. Okay. All right. By the virtue of their genotypic configuration, they have some levels of protection against severe malaria. They can still come down with malaria. All right. So there is a misconception in the past that people who have sickle cell anemia trait, All right, like those who have AS, they say AS.
No, most of the time they talk about AA.
Yes.
The AA genotype.
Yes.
That most of the time they
always come down with malaria.
Yes.
The misconception I want to correct now is the fact that those who have genotype AS they can't come down with malaria. That is wrong. It's a misconception. They can come down with, as a matter of fact, I've treated several who come down with malaria. But the thing is this, hardly will you see them present with severe malaria.
Okay.
All right, because of the inherent immunity they have in them by virtue of the presence of an abnormal genotype in them. All right, so they can come down with malaria, but they cannot. Most of the times they don't present with severe malaria. And the fact is this, even if they present with severe malaria, they recover, they don't die from severe. Any other thing can kill them. Severe malaria cannot kill them.
Wow, that's interesting.
Yes.
Okay, in that regard, it doesn't mean that whether you are AS or you are AA, whatever your genotype
you
is,
can come down with malaria, sir.
Yes.
Yes.
But in that regard, can we say malaria kills?
Malaria is a killer. Malaria is one of the killer diseases we have in the world today. As a matter of fact, the burden of malaria is so much that a lot of measures are going on to eradicate it. Researches are going on to compound vaccines to bring about permanent eradication of
the other time
malaria.
you talked about severe malaria.
Yes.
So I would like you to briefly explain that. At what point do we regard it as severe?
Okay. Yes, malaria could be simple, uncomplicated, or severe.
Okay.
For severe malaria, there are some parameters that we look out for as clinicians.
Okay.
If a patient comes and he or she is prostrated, initially I said something about prostration, that when they come, they are so weak, they are lethargic, they cannot do anything. That is an indication for inpatient care. It is a sign of severe malaria.
All right.
That is after doing the appropriate test and you find out that there is a malaria parasite in the system of the person. Another one is they come, they are convulsing, or they come in coma, or they come, their blood sugar is very low, or they come, they are very pale, they have lost a lot of blood. Their blood level is very low. Is a sign of severe malaria. So they will need to be admitted.
All right.
Yes.
Okay, we will get to talk about all of those things you talked about, the blood sugar. A lot of people really do not understand what it means, blood sugar level and all of that. Maybe some other time when we invite you, we'll be able to talk more about that. We've talked about a lot of things here, malaria prevention and how it can be treated, the right thing for you to do when you observe, you think it's malaria, because you do not have the
capacity to know that it's
exactly.
malaria. That's to have to be tested.
So that's why you should go to the nearest hospital around you. Thank you so much for coming on the show. I've been speaking with Dr. Amos Alex Akojima Graham. Thank you very much for coming on this show.
Sir. Thank you.
All right, he's the acting medical director at Besthope Hospital. Of course, we will be back again next time. Be sure to join us, and of course, we will be talking more about issues that affect everybody. Thank you so much. This is your Viewpoint. It returns next week by God's grace. I am Rotimi Akintunde. Bye for now.